Hello everyone, in this video I'll talk about the surface anatomy of the appendicular body. In my previous video I have discussed the surface anatomy of axial body. Firstly, for the surface anatomy of the appendicular body, we'll discuss the upper limb and then I will discuss the lower limb. Firstly, the upper limb is connected to the axial body by this joint, which is acromioclavicular joint. This joint is made by this one, the distal end of the clavicle right here, and this distal end of the clavicle articulates with the acromion of the shoulder. This one is the acromion of the shoulder. The distal end of the clavicle articulates with the acromion of the scapula, makes a joint is known as acromioclavicular joint, which is this one. Now, what is this acromion? Acromion means it is a bony process which extends laterally from the spine of the scapula. Our next landmark is deltoid muscle, which is a cap-like muscle that sits over the shoulder, and they are superficial muscles. Our next surface landmark is biceps brachii muscle. This one is the biceps brachii muscle. They are the major flexor of the arm, at the shoulder, and forearm at the elbow. They are flexor muscles, and the biceps brachii muscle has two heads. Our next landmark is cubital fossa, which is distal to the biceps brachii muscle, and it is a triangular depression. This triangular depression contains important neurovascular structures of the arm and the forearm, as well as tendon of biceps brachii muscle. The next landmark is radii foveola, which is also known as, this one is the radii foveola. This one is also known as anatomical snuff box. It is to notice this, just abduct the thumb like this. You will know it easily. This one is the anatomical snuff box, which is also known as radii foveola. Now let's go to the palmar surface. Firstly, there are two eminences on the palm. Firstly, the thenar eminence and the hypothenar eminence. Firstly, the thenar eminence. Thenar eminence, it is a soft tissue prominence at the base of the thumb. This one is the thumb, right? This thenar eminence is a soft tissue prominence at the base of the thumb. It is formed by four thenar muscles, and all these four thenar muscles acts on the thumb. For the hypothenar eminence, this soft tissue prominence located at the base of the little finger, and this hypothenar eminence is also formed by four hypothenar muscles, and all those four hypothenar muscles act on the little finger. So in my notes you can see it clearly. Now let's go to the posterior surface anatomy of upper limb. First we have the triceps brachii muscle, which is a long three-headed muscle. This one is the triceps brachii muscle. Our next landmark is olecranon. This one is the olecranon of ulna. The triceps brachii muscle inserts on a bony prominence. This bony prominence is called olecranon of ulna. Now, for the anterior surface, we will talk about the anterior surface of the lower lower limb. Firstly, we have the quadriceps femoris muscle, which is a group of 4 muscles. This one is the quadriceps femoris muscle. Next important surface landmark is femoral triangle. This is located medial aspect to the thigh, and this is located just distal to the inguinal ligament. So in this image you can see this one is the femoral triangle, the one highlighted in green. So it is located medial to the thigh, and this is located just distal to the inguinal ligament. This one is the inguinal ligament, right? So it is located, this femoral triangle is located distal to the inguinal ligament. Our next surface landmark is patella, which is also known as kneecap, and it is a bony landmark located on the anterior knee. This one is the patella. Next landmark is tibial tuberosity. This is located distal to the patella. This one is the tibial tuberosity, which is located distal to the patella. Next one is tibialis anterior muscle. This one is the tibialis anterior muscle. This muscle aids in the shape of anterior surface of the leg. Next landmark is medial malleolus. It is formed by the distal end of the tibia. If you think this one is the distal end, this one is the tibia, and the distal end of the tibia makes the medial malleolus. So this is a bony protrusion, or it is a raised area on the medial aspect of the legs, so it is called the medial malleolus of tibia. And we also have lateral malleolus, which is formed by the distal end of the fibula. The tibia will make the medial malleolus, whereas the fibula makes the distal end of the fibula makes the lateral malleolus. Next landmark is gluteal region, which is also known as buttocks. To define its shape, it is formed by 3 muscles. The 3 muscles are gluteus maximus, gluteus medius, and gluteus minimus. Gluteus maximus is the largest largest and most superficial muscle. Gluteus medius, it is located between gluteus maximus and gluteus minimus, and the gluteus minimus is smallest, and it is the deepest muscle. There are one more feature in the gluteal region, that is intergluteal cleft, which is this one is the intergluteal cleft, which is a midline that separates the gluteal region. This one it runs from the sacrum to the perineum, and this is also also referred as butt crack in English or some native countries. And one more feature in the gluteal region is the gluteal sulcus. This one is the gluteal sulcus, which is an inferior border. It is an inferior border to the buttocks, and it is formed by the fold of skin. Our next landmark is iliotibial tract, which is a large thick band of fascia, which is continuation of tensor fascia muscles. In this image you can see this one is the tensor fascia latium muscle. This iliotibial tract is a continuation of tensor fascia latium muscle, and the origin of this iliotibial tract is iliac crest and tensor fascia muscle, and it inserts on a Geddes tubercle, but in the picture it's not shown. And this now what is this Geddes tubercle? Geddes tubercle, it is a bony prominence on the anterior lateral aspect of the tibia. And the importance of this iliotibial tract is it aids in stabilizing the hip while walking. So whenever we walk, this iliotibial tract stabilizes the hip. Our next anatomical landmark is hamstring muscles, which is located on the posterior aspect of the thigh. And this hamstring muscle consists, or this muscle has three muscle parts: biceps femoris, semitendinous, and semimembranous. Our next landmark is popliteal fossa. This one, which is a diamond-shaped depression located posterior to the kneecap. Anterior we have the kneecap. So this diamond-shaped depression located posterior to the kneecap, which is popliteal fossa. The inferior border of the popliteal fossa is formed by two heads of gastrocnemius muscle, which is important neurovascular passes by this region, gastrocnemius muscle. I will show the picture later. Before that, I will tell the triceps suria muscles, which is our next landmark. Triceps means three, right? So triceps suria muscle, it is a large muscle on the calf, large muscles of the calf, and this there are three heads, right? Three heads is formed by two heads of gastrocnemius muscle and one soleus muscle. In this picture you can appreciate the triceps suria muscles. If you just zoom in, this one is the inferior border of the popliteal fossa. So before I mentioned that, so this two heads forms the inferior border of the popliteal fossa. Our next landmark is calcaneal tendon, which is formed by the two ends of gastrocnemius muscle and soleus muscle, and this calcaneal tendon is also known as Achilles tendon. So again, in this previous picture that I showed you, triceps suria muscle, this one, these two ends forms the calcaneal tendon. Have a look at this picture. The previous pictures that I showed you about triceps suria muscle are little confusing. The triceps muscle is made up of three muscles, right? These were the two heads of gastrocnemius muscle, and this one is the soleus muscle. So this picture is very clear. This one is the soleus muscle. This one is the red one is the gastrocnemius muscle. This one is the suria muscle. That's it. Thank you for watching.